Mexico approves an amnesty law to reduce overcrowding in prison amid COVID-19 pandemic. South Africa unveils a $26 billion relief package to mitigate the economic impact of the coronavirus. And Sri Lanka marks the one-year anniversary of the Easter Sunday bomb attacks. From the headquarters of Telesur English in Quito, Ecuador, this is From the South, and I'm Camila Escalante. The Mexican government has approved an amnesty law paving the way for the release of first-time non-violent offenders to lower the risk of corona outbreaks in the country's prisons. The government says the bill could benefit about 2,600 inmates in the federal prison system. The bill would include those convicted of less serious offenses like non-violent robbery or small-scale drug possession if the culprit was poor, forced into the act, or if they had a disability. Inmates who are indigenous would also be freed if they weren't guaranteed a fully fair process. The bill also provides amnesty for those convicted of abortion. The Mexican government has also suspended all non-essential work activity until May 30th and has asked people to stay at home, although it has not enforced a mandatory quarantine. As of Tuesday, Mexico reports over 8,700 COVID-19 cases and 712 deaths.
Se suspenden
all non-essential work activities in the public, social and private sectors are suspended. This allows the most efficient mechanism to move millions of people out of public space without the need to use public force.
And with social distancing measures in Mexico, people are choosing to buy their groceries in neighborhood stores rather than in big supermarkets.
In Mexico, neighborhood stores have become the safer choice for most.
They come more often, they don't take too long, they leave quickly. This is the best for a small business like ours.
Known also as corner stores, during these weeks, they have become essential as most people avoid large supermarkets.
They take care of us quickly here.
We don't like the supermarket because over there it's more likely to be infected.
They say it's safer because it's less likely to catch the virus here.
We know these people, so we feel safer in our own neighborhood.
It's estimated that in large cities, neighborhood stores supply close to 50% of a family's basic goods.
We are a basic sector of the economy. We offer necessary goods. Not everyone likes going to the supermarket. They feel safer here and are treated well. We know our customers and we like to treat them well.
They have remained open through thick and thin, be it during a hurricane, earthquake, drought, or even a pandemic. We can clearly see that despite the rise of supermarket chains and the arrival of many new competitors, neighborhood stores remain the most important distribution channel of basic goods for Mexico.
Intensive care units across 3 Brazilian states are now operating at full capacity due to the coronavirus pandemic. Our correspondent, Brian Muir in Sao Paulo, has the details.
Last week, health authorities in Amazonas, which is the Brazilian state with the highest number of per capita coronavirus patients, announced that their ICU units in the public hospital system were overflowing. And from that point on, anyone who needed to get on to a respirator had to wait for someone either to recover from coronavirus or die who was in the ICU ward. Now, 2 more Brazilian states have announced that they're in the same situation. Ceará and Pernambuco, which are 2 states in the impoverished northeast, have both announced that their ICU wards are completely full due to the coronavirus outbreak. Now, Brazil has 26 states, plus the federal district of Brasilia, and each one has their own public health system. They have a lot of autonomy on how to use their resources that come from the federal government every year. But the fact of the matter is, although some states are doing much better, the numbers keep increasing. Last week in Sao Paulo, which is the state that's hardest hit in the total numbers of coronavirus patients, announced that their ICU wards were 70% full. And only a week has passed, and the number's already gone up to 80%.
Colombian health workers are protesting against the government's failure to provide them with protective accessories needed in handling patients. The workers, who include doctors and nurses, are demanding that the Colombian government provide urgently needed biosecurity supplies to ensure safety from contracting the COVID-19. So far, 5 health workers have died in Colombia from the virus, and more than 160 have been infected. There is increasing concern over the situation in the country's prisons, where at least 25 cases and 3 deaths have been confirmed.
A state of emergency declared on the prison system has yet to have any effect as protests by inmates continue.
In this jail, there's one worker who has been infected. We are highly concerned because our administration, in coordination with Valledupar Town Hall and the governorship of Cesar, have done nothing to mitigate the situation.
The first cases of COVID-19 were discovered in a Villavicencio jail in the Meta department. From then, the Picota, Bogota, and Florencia jails have also confirmed cases.
The decree by the government doesn't address the most elemental problem, which is death. The already confirmed deaths of prisoners. They are ignoring the reality of our prisons, like they are the reality of Colombian families.
Experts agree that the measures imposed by authorities came too late, and they do not address the demands of the prison system.
There were rumors and complaints of an infected prisoner in Villavicencio jail. This was made known over the social media. Then, on March 22, authorities decided to transfer prisoners to other jails without testing any of them. Today, we have 25 infected in Villavicencio jail and 3 dead, on top of other infections in other jails.
Authorities also announced a process to free prisoners or place them under house arrest, which could benefit 4,000 of them. It will take 2 to 3 months to be put into practice.
United Nations Economic Commission for Latin America and the Caribbean says that the region is set to face its worst ever recession, with a fall in GDP of 5.3% in 2020 due to the coronavirus pandemic.
Además, es una región que ya venía con varios conflictos crecientes en la región de carácter social. Alternativas de reactivación a la luz de los tremendos cambios estructurales cuando se contrae el crecimiento y no se expanden al mismo ritmo cuando está.
And we'll take a short break now. Join us again in a minute. Welcome back. 33 Trinidad and Tobago nationals who were prevented from entering their homeland due to measures implemented to prevent the spread of COVID-19 will return on Tuesday. The citizens were being housed in Barbados after flying from England.
I have been in constant contact with the CMO in Barbados to determine what were their medical status as well as their public health status while they were in Barbados. So a report is pending from Dr. Best. Will come across to me shortly. He just indicated to me a very short while ago that he's attempting to test them before they come. We may get those results not before, but in a short while thereafter. So in terms of the testing, they will be tested as well. Our medical personnel, led by the County Medical Officer of Health, would actually do a full medical assessment of every person that comes to Trinidad. They would also do a public health assessment to determine their risk of contracting or spreading COVID. So that has to be done only when they get here and will be done by a team of experts in County St. George East and St. Andrew St. David.
The Minister of Popular Power for Health, Carlos Alvarado of Venezuela, received a shipment of more than 22 tons of health supplies on Monday from the International Red Cross and Red Crescent. That shipment included medical equipment such as power generators and supplies like disinfection kits, first aid kits, water storage containers, and water treatment tablets, all corresponding to agreements which were signed in 2019 with the organization, which has an office in Venezuela. Last year, 70 tons of medical assistance were received by the organization.
Today we are receiving more than 22 tons of equipment, of medical supplies, and of power generators from the International Federation for the Red Cross, the International Societies of the Red Cross and Red Crescent, with whom we made a roadmap agreement in June of last year to receive on the part of the Bolivarian government part of the technical humanitarian assistance. This technical humanitarian assistance received from the Red Cross is divided, half for Venezuelan Red Cross and half for the national public health system. Last year, we received nearly 70 tons of medical supplies, and so far this year, this is the second supply cargo that we received of medical supplies. It's important to remember that in this agreement with the International Federation of the Red Cross, not only did we make a roadmap last year, but this year, but alongside the Foreign Ministry, we signed the headquarters agreement, so now the International Federation of the Red Cross has a headquarters in the Bolivarian Republic of Venezuela. It is through China is that the majority of technical humanitarian assistance has been received, but also through commercial agreements with China, we have been able to purchase the majority of supplies. We cannot forget that we are in the middle of a blockade which limits and makes difficult the acquisition and access to medicine, access to tests, to diagnostic kits for the coronavirus. So we've been able to strengthen our relation with China, not only in terms of technical humanitarian assistance, but also with purchases. We have already made an air bridge, and we have received 4 flights, and we will likely be seeing the 5th flight in the coming weeks, through the air bridge established between the Bolivarian Republic of Venezuela and the People's Republic of China.
A second shipment of medical supplies from China arrived in Argentina on Monday. We have more in this report.
According to health authorities, part of this shipment are donations from the Chinese government, while the rest were bought for around $4 million.
This plane is carrying supplies by Health Ministry for around 260 million pesos. And as part of this, there's also a donation of rapid test kits, which will be used to combat the pandemic.
Minister Ginés González García also announced the arrival of 200 Cuban doctors, an arrival being criticized by some in the opposition.
We consider all human resources to be critical. This is why we are working to improve our capacities. We are modifying some laws, working with education system so that we can activate doctors who've graduated but are still waiting for their degree, so that they can help us.
The Airbus 330-200 landed in Ezeiza with the medical supplies to test citizens and protect medical workers.
The South African government has unveiled a $26 billion relief package aimed at supporting the economy amid the COVID-19 pandemic.
We are announcing this evening a massive social and economic support package of 500 billion rand. Another significant area that requires massive additional expenditure is the relief of hunger and social distress in our communities across the country. We recognize that food distribution capacity of the government is not adequate to meet the huge need that has arisen since the start of the epidemic.
The president of Madagascar, Andry Rajoelina, has launched an herbal medicine which he claims is a remedy for the coronavirus. The herbal mixture, known as COVID Organics, has been made from local medicinal plants like Artemisia, among others, and is claimed to be able to prevent and cure patients suffering from the virus. The medicinal remedy has been produced by Madagascar Institute for Applied Research. However, the mixture has not been proven effective against COVID-19 by any published scientific studies. And the WHO has also urged utmost skepticism over claimed cures for COVID-19.
So today I think I'm convinced. I'm persuaded. In fact, history will prove us. But today there are already 2 cases that have been cured with the plus Tambovi CVO plus. But we will see what happens next.
Guinea's parliament has elected President Alpha Conde as its head after months of widespread protests, which left at least 32 people dead. The vote comes after the country's contentious constitutional referendum and parliamentary election on March the 22nd. Major opposition parties boycotted both polls, fearing that a planned change to the constitution was a ploy to allow Conde to extend his grip on power, as the new constitution extends the length of the term to 6 years. Ghana has started a program of using drones to speed up the transporting of COVID-19 test samples. The company contracted by the government is also using the drones to help the Western African country monitor the virus in rural areas. Test samples are packaged according to the World Health Organization's guidelines and delivered to the capital, Accra, for processing. The drones are said to be more reliable and cheaper than using cars. So far, Ghana has 1,042 cases and almost 100 people have recovered from the virus, with 9 reported dead.
With the sample volume has increased, and now we are getting samples from all over Ghana. We're very grateful that the zipline drone service is now in operation. After a couple of test drops, we've actually received the first sample today from Suhum. We're looking forward to receiving samples from wherever zipline can get the drone to pick up and deliver to us, because this will speed up and facilitate the sample transport and, of course, the return of the results back to the facilities where the results are needed.
We'll take a short break now. Join us again after this. Welcome back. France has announced that schools will gradually reopen beginning on May the 11th, when the country's coronavirus lockdown is set to end. However, classes will be made up of small groups of up to 15 students each.
This would mean students returning from the week of May 11. Actually, it wouldn't be May 11 itself, since there will be a pre-entry of primary school teachers. But in the following days, we would bring in all the primary school classes. Then we would have a secondary education in week 2, namely the week beginning May 18, with the middle school, for which it would be the 1st and 4th-year students, as well as the high school, and finally the vocational high school, for which we would start with industrial workshops.
The Spanish government has announced that beginning April 27th, children under the age of 14 with an accompanying adult will be allowed to go food shopping, visit the pharmacy, or a doctor.
We are not relaxing containment measures, and it is the responsibility of adults to ensure that minors who go out on the streets effectively comply with these recommendations. These are children, and therefore it is up to us, adults, to ensure that they comply, that their behavior is as so that there are no unwanted consequences.
Italy has announced a new economic package of at least $54 billion, but the Prime Minister Giuseppe Conte says that he will not accept a downward compromise from EU leaders in addressing the economic impact of the pandemic.
The overall European response has not yet reached a satisfactory level, and that is why I will not be able to accept a downward compromise here. This is not a zero-sum negotiation. There will not be some winners and some losers. I am intimately convinced, when we talk about Europe, that we will either all win or we all lose. The government will very shortly be sending Parliament a further report containing a request for a deviation from the previous budgetary targets program for 2020, of well above the figure announced in March, a very substantial figure, not less than 50 billion euros, which will be added to the 25 billion euros already allocated for a total of not less than 75 billion euros.
The United Kingdom has reported 852 new COVID-19 deaths over the course of the last 24 hours, putting the country's death toll to 17,366. But the British Health Minister announced that clinical trials for a vaccine candidate will begin this Thursday.
At no point in this crisis has anyone who could benefit from critical care been denied that care because there weren't enough staff or beds or ventilators to treat them. 17,366 people have sadly died in hospital, which is an increase of 852. I can announce that the vaccine from the Oxford project will be trialled in people from this Thursday. In normal times, reaching this stage would take years, and I'm very proud of the work taken so far.
Sri Lankans have marked the first anniversary of the 2019 Easter Sunday bomb attacks, which killed more than 260 people. 3 churches, 2 Catholic and 1 Protestant, came under simultaneous suicide bomb attacks during Easter celebrations on April 21st, 2019. 3 tourist hotels were also targeted, killing some 42 foreign nationals. The Islamic State group claimed responsibility for the attacks. Most public commemorations were canceled, and citizens were encouraged to remember the victims from their homes.
Today, we are recalling the first-year anniversary of Easter bomb blast in Sri Lanka. One of the most tragic events in the history of Sri Lanka, also in the history of the Church. I'm Father Joy Mariyaratnam. I had the privilege of celebrating that Eucharistic celebration at the shrine when the bomb exploded and killed so many hundreds of people.
Hundreds of protesters have returned to the streets of Beirut, Lebanon, despite coronavirus quarantine measures. Protesters heavily condemn the parliament that is expected to discuss and approve dozens of laws over the next 3 days, including a controversial draft about general amnesty. The drafts also include fighting corruption in Lebanon's public sector, restoring looted public funds, and allowing the plantation of cannabis for medical use. Protests broke out nationwide last October against government corruption, blaming the political leadership for the economic crisis in which the local currency lost more than half of its value.
And this session has 66 articles on it. None of it is dealing with what is happening in Lebanon. What they care about is a law for amnesty, general amnesty. We want to know amnesty for whom? There's no need for that. Now we need solutions for what the country is going through. We need an economic plan. We need laws for economic reform. This is what the country needs. We are in an emergency, and we need to know what the government and the legislators are doing about this.
In Myanmar, a government health worker has been injured while his driver was killed when their United Nations marked vehicle was ambushed. The vehicle was carrying COVID-19 test samples in conflict-ridden Rakhine State when it was attacked at a bridge near the town of Mimbya. Both the military and the Arakan Army rebels of the Rakhine State blamed each other for the attack. Since last year, scores have been killed, hundreds injured, and tens of thousands displaced in a civil war between Myanmar's military and Arakan Army rebels demanding more autonomy for the state's ethnic Rakhine population. Foreign nationals undergoing the 14-day COVID-19 isolation period in the Chinese city of Wuhan have commended the workers for the good services they've received. The nationals who went into isolation upon entering China are required under lockdown measurements, praised the local epidemic control personnel for their hard work and help. This comes a few days after allegations had circulated in media about Chinese homeowners who had been accused of mistreating foreigners.
Are you feeling comfortable? And then as soon as I arrived at the hotel, it's a process. So if you can put it into, for me anyway, putting it into my head that this is a process and everyone here is to do a job, which is to ensure safety, then made me feel a little bit calmer. And all the staff are incredible. Nice, sweet, easy to handle people.
And they usually they used to come to our doors. Are you okay? Are you feeling comfortable or something like that? Life was like that. The management used to talk with us online. How do you feel? Don't worry. After the 14 days, you'll be okay. This is for your health. And I really understand them. This is safe for me to stay inside.
We've come to the end of this news brief. You can find these and many other stories on our website at telsurenglish.net. And you can find us on social media. We're on Facebook, Twitter, and Instagram. For Telus English, I'm Camila Escalante. Thank you for watching.